So we left last class talking about joints, structure of joints, structural and functional classifications, and now we're looking at how those impact movement. And I'm hoping we'll have time to talk about muscles and their role in initiating movement, at least the general overview of how when shortening occurs, movement follows. But we'll see how far we get in our slides today. I do want to briefly, before we get in as a tangent, just commend you on your performance in lab this week. I've heard that everyone is really buckling down and taking care of the details and working really hard this week, and it's noticeable. And so thank you for that. I think you guys should be recognized, and keep that up. That will help a lot for the coming final exams. So good work. Good work. So the synovial joint was the last joint that we left off with. The articular capsule, or the fibrous capsule, encompasses the entire joint. It's full of synovial fluid, which lubricates the joint. It's an oily, fat-like substance. And you can see the articular cartilage lining the surface of the two bones that reduce friction and allow movement. And these are the major types of joints in the body, and ones that we'll refer to a fair bit. Now, there are accessory structures that go along with fibrous capsules, articular cartilage, synovial membrane, and the like. And some of them, most of them, anchor and provide structure and reduce wear. And so bursae, singular bursa, and tendon sheaths are structures that reduce wear. And a bursa is just a pocket, a lot like the fibrous capsule, but that doesn't surround the joint. It doesn't surround the joint. It's a sac. It's essentially filled with synovial fluid. It's a very similar fluid, but it's not around the joint. So it doesn't encompass the bone-on-bone articulation like the fibrous capsule does. Bursa is a pillow that sits outside, and it might be between the fibrous capsule and a tendon, if there's a tendon over top that rubs back and forth during contraction, or between the capsule and another bone or a structure that might wear it down. It's a pillow-like sac that helps to reduce wear from external factors. And tendon sheaths are very similar, only instead of being a pillow, it's a tube that wraps around any tendons in the vicinity that might otherwise cause friction and wear and reduce the longevity of that joint. So it's a tube-like bursa that wraps around the tendons that are subject to a great deal of friction. And I'll show you examples of these in the knee. That's typically a good candidate joint to look at. Lots of wear, lots of force, lots of protection required at that joint to help keep it stable and working. These aren't the only accessory structures. There are a few more. And the two that I've just listed here that we're not going to get into depth on are not even an exhaustive list. Menisci, singular meniscus, or labra, singular labrum, all help to center bones within the joint. And we'll see examples when we get into specific joints of interest like the shoulder joint and the knee joint. We look at those in detail. They all help to center the bones on top of each other and prevent them from slipping off one way or the other. They're not so much for cushioning as they are for anchoring proper orientation and lining the bones up within the joint and keeping them centered. So I threw in a slide here that helps to illustrate how those accessory structures fit in. This is the knee joint. And we're not looking in depth currently, but a lot of the structures we've talked about are evident here. You can see the femur on top, the tibia on the bottom. You can see articular cartilage. You can even trace the fibrous capsule. You can imagine where the synovial fluid would be. And notice the bursae on top, in front, and below. And they're named accordingly, but I took the specifics out just to show you what they look like. They're a pillow-like sac that would be filled with fluid to help with compression and wear from the moving of structures or impacts in those areas. You can't see tendon sheaths here, but you can also appreciate, I haven't labeled it, but there's small fat deposits nearby that provide mechanical alleviation of stress as well, mechanical shock absorption. So bursae, some fat deposits, tendon sheaths, and they all fit together in a really compact, tight orientation to allow flexion and extension here of the knee joint. The other accessory structure that we alluded to that you can see here is the meniscus. This is the lateral meniscus, and it's hard to imagine with this one slide only. It's horizontal from your perspective, and it comes out of the slide at you in a horseshoe shape. And you can see the two sides of it at the knee joint, two little wedges that help to anchor the femur on top of the tibia and keep it centered on top of the tibia, so that when you flex and extend the knee joint, it doesn't move, it doesn't fall off, it stays lined up properly. So these two wedges you can imagine coming out of the slide at you, looping around, and then heading back in. And there's a complementary medial meniscus on the other side. If you were to imagine a labrum, it's almost the same thing in principle, but a labrum is primarily at the ball and socket joints. Shoulder joint, hip joint. Still a rim around the outside of the socket to help anchor the bone within. So very similar functionally, labrum and a meniscus. So let's look at the types of movements you can expect at joints, and you've seen, all of you now have seen these, at least a rudimentary explanation of them in lab. Gliding at a synovial joint is not a common movement. You see these between the carpals of the hand or between the vertebrae of the spinal cord. And I'll hold off on showing you a lot of detailed animations until we just describe the functions. Gliding is slipping, the sliding of surfaces across each other. So it's in line, the bones move in line between each other. It's not as easy to see gliding as it is some of these other movements, which are evident from the outside of the body. Flexion and extension, largely shown here. Flexion and extension often in the sagittal plane. So sagittal plane, maybe the midline, maybe in a sideways sagittal plane. And flexion refers to the decrease in angle between two bones. Any flexion is a decrease in angle between two articulating bones. And then flexion, on the other hand, is the widening or the increasing of the angle between two articulating bones. Sometimes it's easy to understand flexion and extension. Other times, depending on the joint, it seems backwards. So usually in the sagittal plane, some exceptions are shown here. Lateral flexion is not in the sagittal plane, that's in the frontal plane. And we qualify it by calling it lateral flexion. You can bend to the right or to the left. Or flexion of the thumb. It's not in line with, it's not a sagittal plane, it's not even in line with the midline of the hand. Flexion of the thumb is across the palm. So it's not conforming to our typical definition. But every other example that you can see here follows that definition. Flexion of the elbow, extension of the elbow, flexion of the wrist, extension of the wrist, flexion of the knee, decreasing joint angle, extension, increasing joint angle. And then hyperextension, any extension beyond the anatomical position. Extension beyond the anatomical position. So you can't hyperextend the knee. You shouldn't be able to hyperextend the knee beyond the anatomical position. You can hyperextend the shoulder beyond the anatomical position, right? Shortening of the, decreasing of the shoulder joint, angle, flexion, extension, hyperextension. To complement these, usually in the frontal plane, are abduction and adduction. You've seen these illustrated in lab. They are in relation to the midline, usually of the body, but possibly to the appendages, if you're thinking about the hands. Abduction, taking away, stealing away from the midline. You can see the shoulder being abducted in the top left. Adducted as you add them back towards the midline on the top left as well. And that's easy to understand, being that we know the anatomical position quite well and the midline of the body quite well. But then the hand itself, if you imagine the midline of the hand, moving the wrist left or right, results in abduction or adduction respectively. Abduction away, adduction towards. Usually in the frontal plane, and if not, related to whatever part of the skeleton or the limb that you're in. Circumduction, then, not an easy singular motion to describe. It's the combination of flexion, extension, abduction, and adduction all at once and in sequence. Sometimes one singular joint will allow circumduction. So the shoulder joint being a ball and socket joint, the hip joint being a ball and socket joint. Some condyloid joints, which are flattened ball and sockets, will allow circumduction. Sometimes this motion is multiple joints working together. It's usually at the end of a limb, at the end of an appendage, and moving that appendage in a circle, circumduction. Pretty straightforward. One or multiple joints, depending on the location that you're looking at. Rotation, then, would be described according to the originating bone. If one bone revolves around its longitudinal axis, revolving around an axis is rotation. One exercise I'm fantastically familiar with, external rotations and internal rotations. In physio and recovery from my multiple shoulder injuries, the humerus stays stable and rotates about its longitudinal axis. And the qualifier is, of course, related to the midline of the body. Lateral rotation or external rotation is out away from the midline, internal rotation towards. Same thing can occur in the legs, the lower legs, or the femur. You see that on the right-hand side, just to describe the motion. So bone revolving around its longitudinal axis. And then we have other types of movement that are not as well defined, that are special types of movement, that don't conform to circumduction or flexion or abduction. They're a different kind of motion that isn't necessarily common. A lot of these we see at the temporomandibular joint, and we'll look at those a bit more in depth when we get there. But the opening of the jaw is not simply extension of the jaw, even though we're increasing the angle between the articulating bones. It's not just rotation around one point. There's multiple factors that come into play with the opening of the jaw. The one example here that doesn't seem to fit is the foot, flexion of the foot, dorsiflexion versus plantar flexion. If you think in analogy to the hand we had clear flexion and extension using the palm and the dorsum of the hand. Flexion and extension. But the foot, you can argue, depending on the muscles that you're looking at the ankle joint, when the muscles contract and the ankle moves in one direction or the other, the joint closes or the angle gets smaller on either side of the foot. And so we use the qualifier of what direction the joint is moving by identifying either the dorsum or the bottom surface of the foot called the plantar surface. So dorsiflexion up, plantar flexion down. Now these should be no surprise. These types of movements should be no surprise. What we're going to do now is try to connect these movements to specific joints. Not all joints can do all movements. Right? Not all of these joints can do all movements. Specific subtypes of joints can only complete specific subtypes of movements. And we articulated this connection in lab already, but I want to show you some animations that hopefully reinforce this concept with you. There are multiple different subtypes of joints, and in general, when I say joints, I'm referring to synovial joints, and these permit multiple kinds or only one kind of motion, depending on the joint. Not all joints make all movements. So the motion's dictated by the joint structure or the joint subtype, the number of articulations, the space between the bones that are articulating, the supporting structures in the area that might impede movement, the structure of the joint being the first and foremost that dictates the type of movement allowed or available. And it is difficult
as the body
to convey this information just with a 2D slide. Let's see if this works. So you can imagine what I mean by planar joint, a gliding joint. Two surfaces moving together, no change in angle, but sliding across the surface of one another. So we've already mentioned that happens sometimes in the carpals. I'm going to show you that it happens also maybe in the spine. There we go.
As the body moves, the vertebrae of the spine move against each other as gliding joints.
Pretty nice, huh? Let's see it again.
As the body moves, the vertebrae of the spine move against each other as gliding joints.
So notice the motion defined by the name, gliding, two surfaces moving across one another. What else do we have? We have hinge joints. We already know from lab that the elbow is not the best example of a hinge joint because we can do two types of motion at the elbow. But if we think just of the hinge aspect, flexion and extension in one axis only.
Hinge joints, like the elbow, move on just one axis. These joints allow for flexion and extension.
You know, it's not working terribly, but it's not super smooth. The other type of movement at the elbow joint would have been rotation, and I don't have a nice video to show you rotation at the elbow, but you can see rotation at the neck. If we imagine the pivoting between the vertebrae.
At the top of the spine, the atlas and axis form a pivot joint that allows for rotation of the head.
Pretty straightforward, right? And good, I see a few of you mimicking the motion as well. You're getting that experiential learning. Fantastic, good, good. Oof. All all of this AV, my computer is not handling it well. You feel the heat coming off of this. I need to carry it in my jacket outside. Fans going. This is not what I want to show you. I want to show you instead slides. So we have gliding, rotation, hinge joints. What else do we have? What else do we have? Circumduction and pivoting at ball and socket or condyloid joints. You can almost think of condyloid joints like a flattened ball and socket. Similar motion is allowed there, but it's limited to a certain degree. So you can see the condyloid joint on the left at the wrist. You generally have circumduction at the wrist, but it's not through a large range of motion, whereas at the elbow or at the hip, you have a much larger range of motion. Saddle joints, I'm not even going to try to describe them. I'm just going to show you what they do. So let's start with condyloid joints. You can see the action here.
Is a condyloid joint that allows for circular motion, flexion, and extension.
Notice flexion, extension, abduction, adduction, or all of them all at once, which we know as circumduction.
That allows for circular motion, flexion, and extension.
I really thought when I paid the $7 for access to these videos that they would be longer. But they're short, sweet, to the point, and repetition breeds learning, right? Compare that to the shoulder.
Is a freely moving joint that can rotate on any axis.
And that one's easily relatable. You've done those motions before. This example nicely shows the humerus staying in the socket. Consider how unstable that joint is.
That can rotate on any axis.
Any axis, almost any motion, through a wide range of motion. And then saddle joints that I find somewhat difficult to explain, shown nicely here.
Lets the thumb cross over the palm, making it opposable.
So we have defined multi-axis movement.
In the hand, the thumb's saddle joint lets the thumb cross over the palm, making it opposable.
Hopefully that helped articulate some of the movements that you've been wondering about for days, I know. The other app that I have is actually really good too at showing you some of those movements. For instance, let's see if we just focus. This is the triceps, one of the heads of the triceps. And we consider motion at the shoulder, flexion and extension, which we know all too well. Flexion up, the triceps contracts and activates on the way down to, extension. Flexion up to extend down and then hyperextend towards the back. This is also going to come in handy as we introduce muscles today. I want you to just take a minute and think about, can you see that very well? You can't see it too well. You can't see the connections in here very well. But I want you to think about how that muscle is activating extension of the shoulder. Try to think about where it's connected to, from, is what I'm showing you here. And then where it's connected to on the elbow. The shortening of that muscle, the shortening of those fibers will allow movement across that joint, here across two joints. And the orientation of the fibers in that muscle are really what defines its ability to move the joint in that direction. So the triceps is a really nice example where all the fibers are lined up together. We get to something like the latissimus, which you can also see illustrated there. Not all fibers lined up together. Or the deltoids, not all fibers lined up together. So much more opportunity for motion at those joints. Those muscles can act in many different axes. So what then, other than joint structure, dictates how far a joint can move, the range of motion at a synovial joint? The structure of the joint is paramount, the shape of the joint. And then the space between bones, whether they are tight, if there's little space, generally less range of motion, a more static, fixed type joint. If there's a lot of space, if the bones fit together more loosely, larger range of motion. So the example of the shoulder, if you take the 3D animation, they seem to fit together somewhat loosely. Lots of range of motion. Whereas some of the joints, perhaps in the carpals or the wrist, less loosely, less range of motion. Other than the structure and the shape of the bones within the joint, which define the joint itself, accessory structures. So ligaments, you can think of the fibrous capsule kind of as a circular ligament surrounding the joint. There are also individual linear ligaments that move across many synovial joints. They're not always stretched or taut. They will be loose at one end of the range of motion, and then as you approach the limits of the other end of the range of motion, they will become taut and then limit movement. So if those ligaments are taut, if they're short, they can limit range of motion. In a very similar manner, muscles will limit the range of motion. So ligaments span a joint, the fibrous capsule spans a joint. If those are tight, the joint is restricted. Muscles span a joint as well. If your muscles are tight, if perhaps you haven't warmed up and they aren't really flexible or loose in their own right, they can limit range of motion across a joint. The muscles, a lot like the ligaments, can limit range of motion. Things not in the joint can limit range of motion. Soft tissue, skin, fat. When flexing the elbow, you reach a point where your biceps are contracting. The angle between your lower arm and your forearm and your upper arm is not completely closed, but you can't continue to flex because muscle tissue, fat, skin gets in the way. Soft tissues can limit range of motion at a joint. The next example is usually a one-off or special circumstance. This isn't something that happens on a day-to-day basis. This is more of a chronic issue. Chronic release of cortisol with stress can limit range of motion. The book gives a good example of a hormone called relaxin that is released in pregnancy to specifically loosen muscles of the pelvis and joints at the pelvis, which is an obvious benefit in pregnancy. You wouldn't want the opposite to happen. So more of a chronic situation, not a minute by minute, something that can be rectified with a proper warm-up influence on range of motion. And lastly, the use of your joints can limit range of motion. Constant, regular use keeps the tendons, the capsule, the muscles supple and loose. The synovial fluid stays fluid. If you don't use joints regularly, if you're stationary or undergoing bed rest for surgery, if your muscles atrophy, disuse makes that synovial fluid more viscous and hard and gluey, also resisting motion and limiting the range of motion at the joint. By far, though, the structure of the joint is the largest contributor to range of motion. The fit of the bones, the shape of the bones, Accessory structures come next: tendons, ligaments, menisci, bursa, gone down the list. So any questions about this? We're rehashing a lot of the information that you know already, so it should be fairly clear, but I'm happy to entertain any questions that you might have. No questions? Good, let's move on. Joints and muscle, on to muscle. How muscle produces movement. And if all else fails, think back to the elastic band analogy. Everything we're going to talk about, the detail that we're going to add, can be boiled down to the elastic band analogy. How do muscles produce movement? We're going to take for granted that muscles contract, and when they contract, all they do is shorten. That's the only thing muscles can do. Lengthening is not a muscle action. That happens passively. When they relax, they return to a normal length, but it's not an active action of the muscle. Muscles actively contract and shorten, and that's it. You think, stand up straight, have good posture, lift your head up. Your muscles are contracting to do that, but they're not pulling your head up away from your spine, even though it feels like you are. Muscles in the back of your neck are shortening, pulling your skull back on top of the vertebral column, which seems to elevate your head. Muscles only shorten. Muscles shorten and act through tendons. Tendons connect through bone. So muscles exert force on bone through tendons. Tendon you can see on the back here, the white part connected to the bone in the background. Muscle is this big thing that you probably have already had some, at least cursory experience with, but that we're going to explore in depth later. Muscle contracts, exerts force on bone through tendon, and then that pull, that force that muscle exerts through the tendon, creates movement about a joint, not at the muscle, not at the point of connection of the muscle on bone, but wherever the target bone articulates with another one. So there's no actual movement in this background picture here on the bone itself. The bone is not flexible, very flexible in and of itself, but that force creates a lever for that bone to rotate about some articulation point above or below the screen. You can't see the joint on this screen. So muscle creates the pull through the tendon to move a bone in relation to another bone. Those points of connection are the origin and the insertion. And where movement occurs depends on what joints are spanned, are contained between the origin and the insertion. The starting point and the terminal point. So the movement at the joint depends on what joints are spanned by that muscle. The origin is the stationary bone. The insertion is the moving bone. That's how we separate those two. There's two equal points of connection. There's two tendons. They seem to connect to bone somehow at some process, usually a tuberosity or a tubercle. How do you differentiate them? The origin doesn't move. The insertion does move. And so, you can see the origins and the insertions here of the biceps and triceps, the details of which I'll spare you for now, but you can see them if you want to read the labeling on the graph. What we care about is how motion occurs. How motion occurs. So notice here, if you just went back to the elastic band analogy, you would be fine. Draw one elastic band between the origin and the insertion, and you can recreate the same muscle action that a muscle would create. How do muscles create motion? Everything, like you'll learn in biomechanics about motion and muscles acting on bones, is leverage, the creation of a lever. So bones serve as the levers, joints serve as a fulcrum or a pivot point about which the joint rotates. And all we're doing is applying opposing force. All we're doing is applying opposing force. And it's the net sum of those forces that dictates which direction the joint will move in. Just like it's the net sum of EPSPs and IPSPs that determine if a neuron will depolarize. It's the net sum of forces that determine whether a joint will close, will flex, or will open and extend. And so you can see what I'm describing over here on the right-hand side. The fulcrum at the elbow, identified here as an F. The effort, the force generated by the muscle, the contraction is shown here, pulling up through the biceps with the arrow through the biceps, and then the load or the resistance. It could be that you're holding something in your hand, or it could just be the weight of your forearm and hand. It could just be the weight of the limb itself. There is a load or a resistance just in the limb itself. It has a mass. If you're holding a dumbbell, there's more resistance. The joint will only flex, the muscle will only shorten if the effort is greater than the resistance. If the effort is greater than the opposing load. Bless you. So you will learn this in depth in biomechanics next year. This is the makings of what you'll come to learn and love as a free body diagram. I'm showing you the force of contraction, the arrow pointing up. I'm showing you the force of gravity on the limb and the dumbbell, pulling it down. And the question is, which arrow is bigger? That's the question. Which arrow is bigger? If I generate force and actively turn my biceps on, and I have the capacity to generate that strength, and the effort arrow is bigger, the elbow flexes. If I can't generate strength here, and this arrow stays smaller than the arrow pointing downwards, the force heading down, I don't flex. I extend, I drop the weight. It's as simple as that. Which is simple, right? This configuration can be applied in a few different ways. Biceps is one of the most easily accessible. You can think about and look at and consider the forces that are going into elbow flexion. You can observe it directly on yourself. You can observe these directly on yourself as well too. But the fulcrum is simply applied in different relations to the effort and the load in each of these three examples. I don't know why they're first and second and third class levers. I'll leave that for Dr. McKenzie to explain to you. But you can see the examples of moving the fulcrum in relation to the resistance and the load from left to right. So that example of pulling your head back on top of the vertebrae, tilting your head back and up towards the sky. Your skull pivots on the axis. Your head moves up if there's nothing really heavy hanging off of your face to hold it down. Shouldn't be a concern for anyone. Standing up on your toes, the analogy of a wheelbarrow holds true here. Lots of effort being produced at the handles. The load centers down through the middle of the body. And the fulcrum is the point of contact between the toes and the ground. The force might be posterior to that point of contact. That's fine. But if I can generate enough lifting force, I can lift the body up onto that fulcrum. Consider as well, and we won't go into the physics of why, that's not the point of this class, but consider what happens if you move the load closer to the handles or closer to the fulcrum. And you don't need to articulate what will happen. You all have a sense of what will happen. You'll know one gets heavier or feels heavier, requires more force. One seems to be easier. But consider how the distribution of the load might affect the effort required at the fulcrum. And then the example of the biceps over here on the right. I'm not sure why it's a tweezer. You don't really need this upper part of the tweezer. The example persists and holds true if we just use the lower half of the tweezer as well. So fulcrum at the elbow, effort somewhere in the middle, and then the load in the hand pushing downwards. This really isn't set up optimally, is it? Right? You want to do a heavy biceps curl? You don't train the muscles. You find a way to attach the biceps closer to the wrist. It's really not set up well. Look how close to the point of rotation the biceps attach, and you're expected to lift the load all the way over here. That's a large moment arm, creating a large torque. I digress. You'll learn about that in biomechanics. It's all preparation. You've heard horror stories about biomechanics, haven't you? Yeah, they're true. So the earlier I think that you're exposed to torque and force and fulcrums, the better. Let's consider the arrangement of fascicles, then we'll call it for the day. We'll come back and finish summaries on Tuesday next week. So I drew your attention to the triceps versus the latissimus muscles in the example overhead. For any skeletal muscle, fibers are arranged into fascicles, and you can see them joined together here in bundles. And even though fibers are all running in parallel, the fascicles don't necessarily run in parallel. Their orientation within the muscle can vary. A biceps, or a triceps muscle, but we'll stick with the biceps, has two defined tendons. There's only one way from A to B. And in general, the fibers and the fascicles all line up together. Force is only created in one direction. It can only shorten in one direction. If you don't have two defined points, let's say you have a border on one end, a line that eventually converges at a point. Well, all of a sudden, that muscle can contract along any angle between that point and the border. The arrangement of the fascicles will allow you to shorten the muscle in those varying angles, or along those varying angles. They help to influence, or they create a range of motion for that muscle or about the joint. And they can dictate the amount of power the muscle can generate in a specific direction. In a specific direction. So the examples that you have in the book, and that I'll show you briefly here, highlight the many different orientations of fascicles within a muscle, within a skeletal muscle. And the most basic example shown on top, parallel or fusiform, the fascicles bulge out but end up connecting on average in a line, draws the two endpoints together, contracts the muscle end to end. The second example I showed you is in the middle on the right. You have a fan shape meeting at one point, and the muscle can contract up to the left, down to the left, or horizontally? What happens here with a circular bundle of fascicles? How does that muscle contract? Does it elongate? Does it open? Closes. You're providing examples of this right now. There's a muscle in your lips that mimics this orientation, this shape. You can purse your lips, contract the muscles, close that space. A circular arrangement will only contract, muscles only shorten. The only shortening that can happen here is that space closes. There's no contraction to open or elongate or spread or open up that circular bundle. And then we have a host of other configurations here as well, which we will talk about later. How about that? Questions before we close for the day? Okay. Have a great weekend. See you Tuesday morning.